It is just a huge honor today to be podcast interviewing Dr. Maria Meliton from all the way from Lancaster, Pennsylvania. Dr. Murray is a board-certified pediatric dentist in Lancaster County, Pennsylvania. She's a graduate of the University of Pittsburgh School of Dental Medicine and completed her pediatric dental training at the Eastman Institute for Oral Health in Rochester, New York. She has maintained a private practice in Lancaster County for the past 26 years. Her pediatric dental practice, M2 Dentistry, for children and teens, has 2 office locations which are completely fee-for-service. In the wake of many managed care and corporate-owned practices in the area, she has managed to maintain a steady patient base, which she attributes to strong community ties and smart marketing. Doc, thanks for so much for coming on the show. I don't know if you know this, but on Dentaltown, we have some 350 online CE courses. The most viewed category is not endo, implants, practice management. It's pediatric dentistry. And it is Josh Wren put up a couple courses. It's like the most viewed course on Dentaltown. I think it's something that dentists aren't, they obviously want to know more about it. So thanks for coming on the show. Why do you think pediatric dentistry is so, why do you think it's the #1 category of online CE on Dentaltown?
Well, I think there's not a lot of pediatric courses out there, but one of the things that a general dentist sees, are definitely children, and they still find it difficult to figure out how do you get through the day. Like, people ask me all the time, you have the worst job in the world. How do you get through the day? Everybody's crying, everybody's upset, the parents are demanding, and how do you manage to do what you do? So there are ways that, we get through the day, and we actually have days where nobody cries, believe it or not. There are days when everybody's a happy customer, but when you're geared to just see kids all day long, it's a lot easier than when you're seeing an adult and then a senior, and then now there's a 2-year-old in your chair. So adjusting to that, it's a little more, it's difficult in a general.
If I was a pediatric dentist, I would probably be drinking 2 large bottles of Listerine a day. I would probably be swishing after each patient and swallowing. It's the only specialty where if I had to do that, I'd quit.
Here's a fun fact. I don't even drink. How about that?
You don't even drink? Wow. So you're on Xanax then, or what is it? It must be
no drugs, no drinks.
No
I don't
drugs,
know.
drinking. Is it yoga, trance and meditation? What is it?
It's shopping.
So what would you say to a kid in dental school who's a junior or senior in dental school and they're thinking about going into pediatric dentistry? Is it still a good specialty, do you think?
I think it is. It's provided me with a really nice life, and I think that if you're interested in working with kids, there's a way that you can actually make a career out of this and set your own, your schedule, set your own schedule. For a woman especially, it's very nice. It's a very nice field. Going into it, there's a lot of, kids coming out of school now are in a lot of debt, so they have to think about, do you want to specialize after 4 years of college, 4 years of dental school, and now you're going to specialize again, in pediatric dentistry. So you have to kind of have a plan afterwards what to do. There's many opportunities out there to work with group practices, and there's many opportunities to actually buy into a senior doctor that's ready to retire. But in certain areas of the United States, there's a need for pediatric dentistry. Like in my town, it's not a big town, but there's about 6 practices here, and everybody's doing their own thing, very busy.
6 pediatric dentists or 6 dental practices?
I think there's 6 dental practices.
Are you the only pediatric dentist?
No, there's more dental practices, but only 6 specialty pediatric dental practices.
Okay, so what's the name of the town? Lancaster?
Yeah, Lancaster, Pennsylvania.
And how many people live in Lancaster?
You know what? Let me Google that, because I haven't checked that recently. What the population of the town is. It's ever growing because we're near Philadelphia and close to Washington, D.C., and it's a easy drive to New York City as well. It's like 3 hours away from New York City. So we're at 59,000 as of 2013.
Well, if you're a kid listening to this, I mean, it just seems like everybody crushing it is in smaller towns. They're not in New York City. They're not in Philadelphia. They're not in Washington, D.C. They're out in Lancaster, a town of 60,000 people. Um, you know, how long does it take you to drive to Washington, D.C. and Philly?
Washington D.C. is about a 2.5 hour drive, and um, Philly's about an hour and 15.
Yeah, and
Not
that's
bad.
there's another great rule of thumb that if you're 2 hours away from a major airport, you'll just crush it in dentistry.
I think
But
so.
yeah, and I'm 10 minutes from the Phoenix Sky Harbor Airport, and there is a dentist on every corner. There's two dental schools. There's fluoride in the water, and then you drive an hour out away from Phoenix, and there's dentists out there in towns of 30,000, and they're just crushing it. I want to ask you a personal question. Are you a soccer mom? Are you married with kids?
Not married. Longtime partner who's also a dentist. He's sitting right here. He's actually the one that's on Dentaltown all the time.
All right. How are you doing? Do we get to see your face?
He did, right there.
Thanks for being a townie. The question I asked the soccer mom, because it seems like a lot of teachers I know, they didn't have children. They say, I deal with 30 kids from 8 to 5. When I go home, I don't want any kids. Is part of being a pediatric dentist that when you get off at 5 o'clock, the last thing you want to see is a kid, even if it's yours? Do you get your kid fix at work, so you just have
I
furry
definitely
friends?
I definitely get the kid fix at work. It's just a lifestyle choice not to have children. I have a dog. She's plenty. I'm good. I'm good. I get all my mommy feelings at work.
Well,
So
one of the reasons I was asking is because a couple of things. They always tell us now they're telling everyone that millennials are going to be different. I remember when I got out of school 30 years ago. I got in 87. You got out in 89. They were saying that all the women dentists they're just going to get married and stay home and have kids, and so you had to change the estimated productivity of the dental labor force. And now my 30-year class reunion is this Friday, and all of those women they had their average practice was bigger than the average male. They were more successful. They saw more people than the men per person. And now they're saying that millennials, if they want to have children, they're going to want to be soccer moms. So they're going to want to work for Aspen or Heartland or Pacific because they just want to leave at 5 o'clock and be a soccer mom. But I'm sitting here thinking, man, I would want to be a soccer mom that had to work for a boss till 5 o'clock and get permission. I think the ultimate soccer mom would be to own your own practice. So if you wanted to leave at 3 o'clock to go to your kids' play, or if there's an emergency, you own the place. You just do what you want. Don't you think it'd be better to be a soccer mom owning your practice than being an
you have
employee?
more freedom. You have more freedom to dictate your times. I don't know how people do it otherwise. I leave work around 5:30, 6 o'clock, and I see the soccer moms in the vans, and I don't know how people do it when they have a job 8 to 5. As say you're a pediatric dentist with your own practice, and you want to leave because your child is in a play or you need to go to practice, you can leave at 4 o'clock. I have a colleague in town. She finishes the day at 4 o'clock. 4 o'clock to me, it's the start of the busiest time of the day because that's after school. So for me as a choice, I don't have anybody I need to get to practice. So I could stay till 5:30, 6 o'clock. Whereas, that child that has a mom that, can't leave, what do you do? So it's a good profession, and definitely good to own your own place.
Yeah,
I don't
this
want to be
this
service.
it seems like when you've lived half a century, you just start recognizing the same old patterns, and it seems like every generation, the older generation thinks the younger generation is useless and they're going the wrong way, and then that generation crushes it, then they think they're the next generation, and we keep hearing all these things that millennials are different. They're not going to want to own their own place, and they just want to be employees and all that stuff. I just don't buy it for anything because I don't think humans like to be under somebody's thumb. I don't think humans like to be
Yeah.
controlled. They don't like competition. They don't like transparency, and they sure as hell don't like anyone telling them what to do. I think a lot of these people are working in corporate just because they feel like they need to pay off some student loans to get some
I think that's
experience.
what it is. Yeah.
So,
And
so
I'm hopeful that there's somebody out there that eventually wants to take my spot. That somebody wants to buy in and become the next M2, because I'm not going to do this forever. Come on, Howard.
well, would the person he'd have to have a name that started with M, and it'd have to
We
be like a
can
Mark Morin or a Michael.
We can change it.
You could
We,
change that. No, I think you should just interview until you find someone that has a first and last name that starts with M.
help me. You can find me.
So
Somebody.
so so what is we keep hearing in the newspaper the New York Times had an article on that silver diamine, is it silver diamine fluoride?
Yes.
What do you think about that? It seems to be getting a lot of press. It seems to be flying around a lot on social media. What do you think of all that?
Well, anything that's new and out, there's a lot of do's and don'ts with it. So the topical of choice right now, is supposedly it's to help relieve hypersensitivity, but I've not actually worked with this. I'm kind of cautious when there's anything new or controversial first. I like to see what everybody else is doing before I jump in. It's a small town. It's hard enough to try to get people here to want to do fluoride, believe it or not. We have a lot of those that come in that, absolutely no fluoride. It's like a smorgasbord. Just a cleaning and exam only, no fluoride.
What percent of the moms think don't want their children exposed to that harmful caustic communist
I
fluoride?
know. Well, it's at least a quarter of the population of the practice.
Well, I that's the same number I see when you try to fluoridate. Like I was involved in the fluoridation of Phoenix campaign in '89. Then when that expired, 20 years later, did it again, and it's about a quarter of everyone in Phoenix thinks that it's you shouldn't put it in the water. It's toxic. It's a communist plot. It kills people. It causes autism. I mean, it just goes on. So it's about 1 in 4.
It's about that, and also what factors into that is the insurance coverage. What is it covered? If it's not covered, we don't want it. But at the same time, the pediatricians are doing a lot of it in their practices now for like baby exams. They're doing the fluoride, the varnish. So the parents come in. Is that really a good thing? Like, should we have the kids getting it twice in your office, once in their office, or every visit? I've heard it with every visit to the pediatrician, they're doing a fluoride varnish. So I don't really know. But like having this alternative where we can actually save a tooth from being drilled, it's another sales pitch, that you have to convince people that it actually works. It's not in the New York Times, it's in the press, but I don't know. Our population here is a little more conservative. I mean, we see a lot of Amish and we see a lot of Mennonite, and they tend to believe a lot more of the propaganda that they read about in their own publications, and they still think fluoride is poison. They think it's poison. So I can't imagine how they would feel about anything that would be perceived as quote unquote new.
So
I guess they.
let's talk about the fact that you've been practicing for 3 decades, 30
Oh,
years.
no,
Well,
26. Not yet.
26, 26. I'm rounding up.
Okay.
The question is a 3-decade epidemiological thought. Do you think 3 decades later there's more pediatric decay, the same, or is it decreasing? What are you
Well,
seeing in Lancaster?
I think there's more. I actually think there's more. Even in populations that aren't, like the Amish or the Mennonite, just regular folks, off the street, either blue collar, white collar, it doesn't matter. There's a lot of overindulged children. I mean, they get their juice bottle at night, or they get a snack, but right before bed, and it's usually something that they want so that they'll go to bed, whether it's a sticky gummy or, you know, something that's just not good. Like yesterday, for example, I did an exam on a child that they took the pacifier away at 2, but he needed something in his mouth to fall asleep, so they gave him grapes. So he slept with grapes in his cheeks.
Well,
I mean,
that's got to be perfect because it's natural. If it's
and it's a choke
natural,
hazard.
it's good. I mean, tornadoes are natural, hurricanes are natural, exploding supernovas are natural. If it's natural, that's why when the patients they get so confused, the filling, you say, well, what is the most natural filling you give? And I said, well, that'd be the mercury silver filling. It's half mercury, the other half silver, zinc, copper, and tin. It's all formed naturally in an exploding star and a supernova. And the tooth colored fillings, that's all just chemicals made in a test tube by men in white lab coats. And
Yeah,
then they say, well, I want the tooth color. I'm like, well, then why did you ask me about the natural?
exactly. Like, can we do this argument? But What do you think that child had with all those grapes? He had class 5 lesions on every single tooth, so 20 out of 20.
But they were natural cavities, though.
They were natural cavities. They were not because of candy, because it was naturally grape.
Yeah, and a lot of those snack bars, like I had a lady the other day. She was 52 years old, and she says, "Well, I'm trying to be more healthier, and I now don't put sugar in my oatmeal. I just put honey."
Okay.
And it's like, well,
Natural.
sugar is pretty natural from sugarcane, and honey's pretty natural from bees, but I think they both feed bacteria the same way. So you think decay has gone up?
I think it's gone up. A lot of people also wait too long, I think, to bring their children in. That has to play a part. If they're patients at a practice that says, "Oh, we don't start the kids until they're 3," sometimes when I see them at 3, it's already, interproximal caries is already there. And it's early childhood caries is a real thing. I don't know what exactly the factor is that why people wait, but a lot of it is, perhaps thinking their child can't do it yet, or the general dentist feels that they're just going to make the child cry, so let's wait till he can do it. Or some feel, let's wait till he's ready to go to school and we have to fill out a kindergarten form. But the fact is, I've seen children as young as 18 months old or even younger having decay, just from habits at home and what they've chosen to give them as far as food and drinks.
So let's talk about racial, ethnic differences. I like traveling around the country and seeing how ethnic diets affect decay. You live in a big Mennonite and Amish population. Do they have a distinctly different diet than your typical blue
Yes,
collar?
they do. I mean, their foods are very high in sugar and carbohydrates. So a lot of their cakes and pies and all that goody stuff. I mean, they have something called shoe fly pie, which is basically molasses in a crust. So when they have that kind of diet, and then their hygiene isn't always 100%. I mean, their hygiene is always questionable when they come in. We refer to it as your teeth are wearing sweaters. They're covered, they're just coated, and sometimes brushing isn't a priority in their household. Um, you combine the two of that, and then they also love juice. They love that's very sweetened. I think the one that I keep hearing about is papaya juice. Where do you even buy papaya juice? But the kids come in here and it's 20 out of 20 teeth that are bombed.
Do
Um,
Amish smoke or drink, or Amish or Mennonites, do they smoke cigarettes or drink alcohol?
well, they grow tobacco, so I'm sure that they do smoke it, but it's secret. Like, you don't really see them out smoking.
Maybe they chew it.
Maybe. I'm not quite sure about that.
But it's not like the Mormon religion where you're not supposed to use
No,
alcohol or
no, because they have that period of time where they don't join the church yet, and they have what's called Rumspringa, where before they join the church as a teen, you have the opportunity to kind of sow your wild oats and go out and party, and then you join the church. So
yeah.
they,
There was an HBO series on that. What was that called?
um, I don't know, Breaking Amish. I don't know.
Yeah, there was
There was something on
there was.
TV.
I caught a few episodes of that, and I found it very interesting.
Yeah, it
I'm
is.
from Kansas, and most people don't realize that Kansas has a huge Amish population. Um, I mean, just very large Amish population. It's the largest Amish population and Mennonites west of the Mississippi River.
Wow. Okay. So more than what we have here
And
in Pennsylvania.
it's so cute because you'll be driving Kansas, and the government made them put a reflective triangle on the back of their horse and buggy thing, and you'll see this extremely traditional family, and you'll see two little girls in the back all dressed up in their deal on an iPhone. You're
Oh
like,
yeah, we do have iPhones.
who's like, what is wrong with this picture? We have a horse and buggy, and the daughter's on an iPhone. One of these things doesn't go with the other, but
It's,
so they have a diet high in carbohydrates and sugars.
yeah, and hygiene isn't, like it could be better.
So
So
when
it's very rare that we see an Amish kid, bless you, it's very rare we see an Amish child with no decay. It's rare.
when you are growing your business, do you focus more on the pediatricians to get them right out of the gate, and hopefully they're in your office by the time they get their first tooth or their first birthday, Or do you tend to market towards the general dentist who's basically referring you to someone that they're having a behavior management problem with?
It's a little bit of both. I would love to get them straight from the pediatrician, and we do get that. But getting them from the general dentist, sometimes it's already too late because they've either started treatment already there and they couldn't finish it, or there's already decay that perhaps they couldn't get x-rays very early on and they weren't able to diagnose it. So it's a little bit of both. But what really helped my practice along, I think, is word of mouth. So it's more moms upon moms that are, they go to dance school, they go to, playtime, or like, they have the mommy and me playtime. That tends to be the strongest, I feel, marketing for me. Pediatricians are great because I almost feel like when they're coming from there, they've already been diagnosed with something that is of concern. And they tend to send a little earlier. With general dentists, it's kind of hit or miss around here. A lot of the really good kids, they'll keep them because frankly, they're better than some adults, So if we do get a child referred from a general practice, it's either they have a lot of treatment that's needed, or they've started treatment there and they couldn't finish it because of behavior and compliance. And often they want them back after you treat them. So, and that's fine. We respect everybody's wishes, especially if they're a strong referral for us. But we find that, it's a cross section of a lot of those different things. But word of mouth for me is the best. And social media is really, I think it's great. It's powerful.
So let's go into behavior management. So percent wise, 100% of your practice, what percent you just treat them, just like they're a small human? What percent you have to use like nitrous oxide, or and what percent do you literally have to sedate them?
There's a good number of kids that I have to sedate because I do see under 3. There's a lot of kids under the age of 3, and sometimes even 5 to 6 that have just been treated somewhere else, and they're really fearful. But often, like, you'll be surprised how many children come in here, and if we can gauge their behavior and compliance on that first visit, that they're actually able to go through a procedure with nothing, no nitrous, no sedation.
What percent is that of your practice?
I would say that's about 25% that can do it without anything.
So a quarter nothing, and then what would be the next
Or
percent?
maybe higher than that. Higher than that. It should be higher than that because I have some older kids that they don't require. I don't even have nitrous in the practice. I've never practiced with nitrous.
You don't have nitrous and you're a
No,
pediatric dentist?
No, I don't like it. I don't have it here at all.
Well, why do you not like it?
When I was resident and training, I used to get some wicked headaches from it, and my program director said, "You're just gonna have to learn this without it." I'm like, "Okay." And that was Steve Adair, and I remember him saying that to me, and he goes, "You're just gonna have to learn this job and how to do it without nitrous oxide. Since you come out of here," I would come out of the room completely red in the face and just bad headaches, and I don't know why. Nobody else reacted that way, but it was me. So I never had it in the practice. And 2 offices, 2 locations, and we've never really needed it. I do spend a lot of time with the kids to talk them through it. Tell, show, do is my go-to thing. And getting good, profound anesthesia, that's the other way. The other, I just make sure I give them plenty of time to get numb and knock on wood.
So then what's your next level up? If tell, show, do doesn't do it, what's next on the
Usually we try to see if we can really do it in the office and do it in multiple visits. I try not to do too much at one time because that's also a factor in behavior. We do work with a board certified dental anesthetist, an anesthesiologist. He comes to our practice and provides sedation for me. And I also am on staff at a hospital here and do some treatment in the surgery center. So.
And what percent of your patients need an anesthesiologist in your practice or in the hospital?
Hospital, I would say 5%. We try not to go there if we don't have to. Typically, I reserve that for kids that, either they're medically compromised or there's something that I just don't feel comfortable sedating them in the office for. Or if the parents request it, they want to be in a surgery center. But for our dental anesthesia, specialist, I would say like 25% need it. Not a lot.
And is that and what are they sedating him with?
Well, he has a cocktail. He gives them an IM pre-op injection of, is it ketamine and Versed, and then he starts with starts an IV and administers IV sedatives through that through the course of the procedure, and we try to maximize the amount of treatment that I can do in one sitting, and it's been great. He's out of the University of Pittsburgh. He's on faculty there, and he runs a private practice, actually, in the Pittsburgh area, which is about 4 hours away from here. So he travels to Lancaster once or twice a month, and he works with me and another pediatric dentist in the area. So he's actually here right now. He'll be here tomorrow with us for a full day. You should come back tomorrow.
Wow. Hey, tell him I'd love to podcast him. I've never podcast interviewed a dentist.
Oh, really?
Is he a dentist too?
He's a dentist too, but
Yeah.
he just dental anesthesia.
So there's just a few programs like Pittsburgh, Oregon. There's not, what is there, like 6 or 7 dental schools that have a board certified dentist anesthesiology program?
There's not a whole lot of them. Yeah.
Tell him that that's I've never podcast one before.
Oh, you just walked in the door. You want to meet him?
I absolutely do.
Come here. Say hi to Dr. Howard Farran. He's never talked to a dental anesthesia before. Anesthesia.
Hello.
There he
Hey,
is.
buddy.
Bag
How
of
are
goodies.
you doing?
Look
Good,
at
how
his
are
bag
you?
of goodies.
Are you familiar with the Dentistry Uncensored podcast?
I am not.
It's a podcast show we do. I'd love to have you come back sometime for an hour. And I've never interviewed a dentist board certified anesthesiologist before.
Done.
Can we do it?
Sure.
The gentleman sitting next to you is a big townie, so he can. Are you familiar with Dentaltown?
Dentaltown. I know the magazine, but I.
Yeah, it's got a magazine and a website, and this is a podcast we put on the website. But the show's a big hit, and I'd love to talk to you about that sometime.
Great.
So
Sure.
email me, howard@dentaltown.com, and we'll find a time.
Will do.
Perfect.
All right. Thank you very much, buddy.
You bet.
That was a good segue.
That was a good segue for an upcoming show.
Yeah.
So it seems like dental anesthesiology, I mean, that's just a high risk, high stakes game. I mean, it seems like
It's a little on the, we don't take it for granted. We try to really encourage people to, talk to Dr. Brandy, the anesthesia doctor beforehand, just to answer all their questions about what we do on our end to make sure that it's a safe procedure for their children. One of the things that we do is we make sure that child is completely healthy. There's nothing on that medical history. And he's so good at what he does. We've been working together for over 10 years. Knock on wood, they're not a problem. But we're also very cautious of, yes, exactly. We're also very cautious about, what our limitations are with children. They can desaturate very quickly, and we know what our limits are in terms of how long we're working. And, and he definitely knows how much to dose out for each child, depending on what the procedure is going to entail. But it's been a great added extra little bonus to our practice, because there's not a lot of people in the area that actually do it.
Yeah, those are the two things. That's the one thing for me, it'd be just too high risk. I mean, I don't want to do any anesthesia. I'd be like you. I'd want to get a dentist anesthesiologist to come in.
Exactly.
And you do two rare things. You do pediatric dentistry, which I would never do, and the man that just walked away does dentist anesthesiology, which I would never do. Those are just two things.
See, I often say, like, I'm going to do the thing that I'm the best at, and that's pediatric dentistry. So I want to find the person who's going to be the best at giving anesthesia, and that's this guy. He comes 4 hours away, rents a hotel room, comes to our practice once or twice a month, and then we just book the full day with patients. And he does it with many other offices in the Pittsburgh area.
But even though he's a dentist, does he buy himself a big Amish pie when he's down there and takes it
I
back?
think we get it for him.
Yeah, for him. Help. These are the two big problems I have working on kids. Number one, I'm in Phoenix, Arizona. I'm across the street from the Guadalupe Indian Reservation. At least half the moms say, "Well, it's just a baby tooth; it's just gonna fall out anyway."
Oh, you hear that?
So what's your standard response to? It's just a baby tooth. It's gonna. Why do I want to put money into it? That's just gonna give it to the tooth fairy around the corner.
Everybody thinks they all fall out at the same time. So I always explain to them that they didn't all come in at one time, so they're not all going to fall out at one time. And if the child's only 3 or 4, they're going to have some of these teeth till they're 11 or 12. So we need to do something about the teeth, especially if they're already bad. And if it progresses, then we're running into a problem of infection, swelling, and severe pain. So I think from that standpoint, when we explain it in that way, it kind of lights the light bulb above their head, like, oh, I get it. So we do need to do something, because it's not going to last, 8 years of how's this tooth going to look in 8 years, in other words. So it's a tough sell sometimes because they think it's just a baby tooth. But when you explain it in terms of, it's part of the digestive system, you have to be able to eat. You have to be able to have some comfort. You have to be able to go to school and concentrate. There's a lot of those factors that parents don't take into play. And a lot of it, I get it. It's to save money. It's to conserve money. But we try to really practice in terms of prevention with our patients and show them that, twice a year going to the dentist is a lot cheaper than waiting and going every 2 years. And every 2 years, there's a major problem. It's just cheaper.
It's amazing how 56 million school hours are lost each year from children going to the dentist. 56 million. Next big controversy. Mom wants to be in the room. Do you let her, or do you make her stay out in the front room?
I don't have a strict rule about that. I find that if the child is better behaved with the support of mom or dad in the room, then I allow it. But if I find that it's disruptive, and that's happened sometimes where the mom's more needy than the child, I have to separate them and politely explain why. Sometimes kids go to school for a reason without their parents because they pay attention better. The teacher becomes the authority figure, as opposed to if mom's in the room and the child shows off, quote unquote, shows off for mom, and doesn't pay attention to the dentist. So we're not going to get anything done. So it's always that balance of knowing exactly what to say without offending the parent, because a lot of them, they want to stay with the child. But if they're quiet, passive observers is what we call it, then it's great because the child still feels secure that the parent's still in the room, but they're not interrupting the dentist or they're not disrupting the child's focus on what we're trying to accomplish.
Do the Amish and the Mennonites send their kids to school, or do they homeschool them?
They have school. They have Amish school. They go to
have their own. Is it their own private Amish private school, or is it?
Well, yeah, it's like a one-room schoolhouse. There's different schools in different regions of the county, but
they're not government affiliated.
I don't think so. Yeah.
And then how do you deal with this is a divorced parents? The mom comes in and says bill it to the dad, and you're like, okay, well, where's the dad? And sometimes it seems like they're almost playing the kid in between. It's almost like the kid is some pawn in a weird dysfunctional post-divorce kid. Do you see much of that? Or is that not really issues?
It's all the time. And, we really try to take care of that problem early on the process, when they become patients in the practice, by saying the parent that brings the child is responsible for the financial part of it. And we try not to get in the middle of it because there are some families, unfortunately, where the dad isn't in the picture at all. And if they put that as the person who's in charge of the account, you can't even find them. How am I going to find them? So it's a tough balance. We have families here where dad lives in another state, mom lives here, and whenever we bill them, they split it in half or whatever their divorce thing calls for. If it's 80%, dad pays 80%. He calls us with the credit card. Mom pays the 20% while she's in the office. It's a lot of tailoring for each family.
And there's also weird things I see in my practice where You know, the mom will come in and we'll agree to do this, and then the dad calls and he's all upset because he doesn't think
Yeah.
this is a treatment or this or that, and you
Yeah.
know it's just all coming from some weird
They're fine.
relationship
Yes,
issue. And
it's exciting. We had one not too long ago where the mom brought the child in, and then the dad called me and said, I know she has a lot of cavities. And I knew he was either recording me or he was trying to bait me by saying that the mom was a bad mom. And I said, well, I can't tell you that. All I know is that she lives with both of you and she has decay. And that was the end of it. You know, she lives half the time with you, half the time with her. So I don't know who's not brushing her teeth or giving her junk. But either way, you're both equally responsible. So that was the end.
and what are you telling the parents? You know, how do you balance the mental health benefits of sucking your thumb and a pacifier versus the oral health detriments? When do you say? I mean, because I'm jealous of all thumb suckers. I wish every time I was stressed out, I could just go suck my thumb. You know, I instead of having to eat something or go do something or you know. I mean, I had 4 children and one of them was a thumb sucker, and I just was so jealous because man, it was like the greatest thing in the world. He didn't have any other vices. He just wanted to suck his thumb. But you're wondering, so when is the mental health benefits not outweigh the oral health detriments? What are you telling parents?
If they're going to school and they're getting their permanent teeth, I think it's time to really consider stopping. Sometimes when they try to wean them from either the pacifier or the thumb too early, I think it's frustrating for a 3-year-old. They don't understand. So closer to a school age child, maybe 6, 7, you know, there's ways to correct that orthodontically down the road. I just always try to see it from the child's point of view. Like, why is he doing this? Is it for comfort? Is it because he's bored? Is it just because, you know, he's not even thinking about it anymore? It helps lull him to sleep. So there's a lot of different factors that, you know, we try to work with parents to do different things to help them to stop. You know, you tailor it for each child, whatever works. But a new thing that it's not really that new, but I've been telling parents, you know, with the pacifier, give it to them every other night. Teach them the days of the week, especially if it's a 4-year-old. Okay, Monday is pacifier night. Tuesday is not. Wednesday is pacifier night. By Thursday, guess what? He's already forgotten.
Have you seen that other method that they're talking about now, where if it's a binky, you know, they suck on it. So they start with they cut the end of it off, so there's a hole there, so that they can't get the sucking, and then a lot of people say
It
then
could
the
work.
child,
Yeah, I could see that working.
and
I
then
saw,
go
I
ahead.
think a pediatric dentist in Pittsburgh came up with that. Is that right?
Right. I got her lined up for a podcast. I
Yeah.
wanted to do you first, and but yeah, I have her on show. But yeah, and so you cut a hole in it, so now you don't have the sucking, and then if it's still going on for another week, you trim off like another couple millimeters, and you just keep cutting
It
this
just
thing back
loses
until
that
basically it
appeal.
can't even keep it in their mouth.
I think it loses that appeal for the child as it gets smaller and smaller and it doesn't feel the same. So I can see it working actually.
I'm going to start an adult program to teach you how to revert back to thumb sucking, the
Okay.
ultimate vice. You know, you don't need a 6-pack, you don't need a pie, you don't need to watch HBO movie. Just teach adults to just start sucking their thumb again. I need to ask my mom to ask her if I was a thumb sucker. Maybe that behavior is still in there somewhere. So there's 6 pediatric dentists in Lancaster. How many of them are men and how many of them are women?
There's mostly men, but there's women that are associates with one of the bigger groups out here. I think
Because
there's 3 women in one group.
Because when you and I were little, OBGYNs were all men, and now they're
Right.
all women. And it seems to be, just from going into dental schools, that whenever I see a pediatric residency class, it seems like it's all women. And
I think
I
it's
believe,
leaning towards that way.
yeah. So do you think it's going just like OBGYN?
I think so. I'm seeing that more and more. I think in my own, where I did my residency, I think there's more females now versus men, whereas before it was the opposite. You know, I think my year there might have been half and half, but now I think more women are going into it. I think the perception is that women might be a little softer. I'm not sure about that though. I mean, I'm not not saying one way or the other, but some people do choose me because I'm female.
Well, I think it's something that needs to be really thought about because,
Yeah,
the data is pretty clear that, that 92, 93, depending on what you're reading, percent of all healthcare appointments are made by women.
they're the ones that
So if
decide.
women are making all the appointments and women are specifically, I mean, so what do you think it is? Why do you think moms would rather have Mariah as opposed to Mario?
Well, it's Maria,
Maria instead of Mario.
but I think maybe because I'm just speaking from my perspective, maybe they feel a little more like less threatened. If they come in with questions, they feel maybe that they can relate to me. A lot of my friends I've met through the practice, it's funny. A lot of the moms want to be friends, and that's fine. Um, so I think from that standpoint, it's helped my practice a lot to have um, these patients that have become friends in the community, and it's kind of just helped me to network more. I think it's from that standpoint where they look at your website, they see that, oh, she's board certified, oh, it's a female, I think my child will do better. Especially moms that feel that their children, respond better to mom versus dad, who maybe dad's always away or dad's a different kind of parent. Dad's more the fun, whereas mom's the one that gets you to do your chores or gets you to do um, the things that you have to do at home, like brushing your teeth and washing your hair. I don't know, but I find that it does help me out a lot. That some parents chose me because I am female. And it doesn't matter if it's a female child or a male child; it's the same.
So, did you see in JADA last month the article "Time to Talk About the Gender Gap in Dentist Earnings" by their chief economist Marco Vucicek? That 5 to 9 years out of school, the average female dentist is making about 37% less than their male counterparts. 10 to 19 years out of school, it's 20%. So basically, the first 10 years, they're making about 40% less, and the next 10 to 20 years, about 20% less. Why do you think that is? Because one of the things I always wonder is, are women less aggressive treatment planners? Are they diagnosing more conservative? Do moms believe it more? Are males? Because males, when you look at the species as a whole, it's an aggressive animal. I mean, it's something like of the 30,000 Americans who die each year from an accident at work, it's a man. 95. When they talk about the income gap, well, men take all the dangerous jobs. They're cell phone tower welders. They're working in mines. They're out catching lobster in the middle of the ocean. But do you think that moms think that if Maria said my daughter had two cavities, that they believe you more than if a man said it? Maybe they're trying to sell you something because the data.
Oh,
I mean, well, let me just ask you this. I'll shut up. How do you explain the gender gap? 10 years out of school, first 10 years, 37% less income. 10 to 20 years out of school, 20% less income. Why? How do you see the gender gap?
maybe 10 years out of school, a lot of those women are in their 20s and 30s. Maybe they're busy starting a family, getting married, like all those things that, that my classmates were doing as we were graduating school. So it might have been a little bit more of a hindrance, whereas, the male students, they had to provide, I don't know, in specific gender roles, like they had to get out, pay for their student loans, and provide. Um,
And you're a
whereas,
genius because you avoided those two mistakes. You neither got married nor had children.
no way.
You are just a genius.
Thank you.
You probably have so much money. You just have wheelbarrows of it.
Not really. Not as much as you.
So you would explain that 37% less income than their male counterparts to dental graduates as probably having babies, starting
I think
families.
so. I mean, that slows you down if you're going to take maternity leave. How do you do that when you're starting your own practice? A lot of women, I think, come out and they want to work for somebody just so that they have that flexibility of saying, I only want to work 2 days a week because I'm going to have a baby, and then they go in after the baby's like 3 years old. They go in, okay, I'm going to go back to work full time. Full time to a lot of people is 4 days a week. And then they go, oh no, I got pregnant again. So now you have to take more time off. So it's disruptive. How do you build a practice when it's, you're trying to also build your life, which, nothing to be said about that. I mean,
And it's sad being in so many of women's dentist relationships because I've been with a female dentist who broke down and bawled like a baby for an hour because she had her practice for 8 years. It was doing good. She was making twice as much money as her husband, who worked for a Fortune 500 company, and then they transferred him to Seattle, and he's going. So
and then she has to move.
yeah, and she has a reoccurring annuity business with recall, hygiene, brand building, and his
Yep.
ego is the size of a walnut. And she literally has to decide: do I just let this idiot go and bust up the family, or do I move? And I said, don't move. And but they always do, and I always think, man, that's just tough. And also, women dentists say, even women dentists married to male dentists, when they go home, their male dentist wants them to do the cooking, cleaning, kids, homework.
Hello. I do. You have to get a girl that does all. I do it all. I go home, I cook, clean. I just don't do the kid part. So I've already done that during the day.
So
Right?
it's tough because you got a modern day woman
You're right.
married to a 2 million-year-old Homo sapien monkey with human clothes on. I mean, you can dress him up, you can put a tie on him, and you can give him all these fancy titles, but you're still married to a monkey. And
Yeah.
and there's
And
something,
divvy up those chores have to be divided. That's what needs to be done in a household.
yeah.
So I cook, you clean.
So back to the gender gap. Do you see anything bad about? I mean, do you see like discrimination as a woman dentist? Do you think there's any?
So, I mean, I
You don't
think
think
we're
there's anything?
responsible for our own fate. I mean, if that's something that you chose to do, you only want to work a couple days a week because you're raising a family. I don't think that's discrimination. That's just a choice. That's a personal choice. I don't think that, insurance companies are paying women less. I don't know. I don't know if that's
Good points.
right.
Good
So
points.
it's
I
just
want to ask you about new technology things. We've seen, the chrome steel crown has been a silver filling forever, and you see some of these new companies. There's one out of Houston, but you're starting to see some tooth-colored crowns. Have you tried those? Do you like those? Do moms ask for
no,
them?
I have tried other brands. I will not name the names, but
It's Dentistry Uncensored. You can name them,
okay.
address, website.
No, I don't want to get hate mail, but I have tried them where during the course of like say 6 month period to 12-month period, I've kind of just watched how this evolves in a child's mouth with normal wear and tear. And I found that, they would wear them down to almost, I used this one crown company one time and it just wore it down to what was underneath it, which was metal. So what was the point for that? So now that they have the new zirconia crowns, like that's on one of my to-do lists definitely is to learn how to do that and maybe market it into my practice. Like having a practice, I have two locations. One is in a more rural area where there's a lot of Amish and Mennonite. And this practice where I'm at today is a little more suburban, it's upper middle class families that, once in a while I do get a request for a white crown, because that brown tooth was better than the silver tooth that I was going to recommend. So the zirconia might be a good alternative for those families that are looking for the white crown. But I don't know how many more people would really ask for that, but I think it would be one of those little specialty things that I could have that, I know enough. I don't know very many. I don't think there's one in the area that uses the zirconia.
Another one of the most I love dentists. I do. I love them. I think the neatest thing about being a dentist is that everybody that works in your industry is a dentist. I mean, they got 8 years of college. They've read 1,000 books. They're fun. They're a fun group to be a part of. But I think the funniest thing is about how their mind work is they still probably 98% of them believe that their composites last longer than amalgams, and the research is completely clear with zero ambiguity that amalgams last twice as long as tooth color fillings. Is it different for you? Do you use amalgam? Do you only use composite? Is it a different mindset since the tooth only has to last till they're 11 or 12?
I definitely do not use amalgam anymore. I think the last time I used amalgam was maybe 15, 20 years ago, maybe.
And why did you stop using them? Did
Parents didn't want them. They were all, it was always
Marketing.
requested for, just, can we do a white filling? Can we do, can we avoid that? And then here in the area too, where the Amish don't even want fluoride, they don't want mercury. They see it as mercury. So they don't even call it amalgam. They just say those mercury fillings. You don't do those, do you? So I say no. I use composites, and
You're right. There's no market for 'em. I mean, nobody wants a silver filling.
no. And I'm able to do a more conservative preparation for the tooth, and it looks pretty afterwards. And
Explain this to me, since you're a woman dentist. Why do I have 7 restorations? They're all gold. Women decorate every body part they have with gold, from their wedding ring to their nose to everything, but they won't let me put a gold crown on their tooth. Why do women decorate every part of their body but won't let me do a gold crown, even if it's tooth number 2? And I tell them I'm the only one that'll see it, and all mine are gold. What is it with gold?
I think they just want tooth colored everything, and everything has to be within the confines of what they find as attractive. And white teeth, I mean, they want it to be like white, like a piece of paper white. They can't even vary from, well, that shade looks really fake. No, we want the whitest you can get. And the same way with, even though you can't see number 2, that in their minds they still think, oh, it's metal. I don't want that. I don't want that silver thing in my mouth. It will. It doesn't matter that it's clashing with the silver ring in their nose, right?
So you have 2 offices. One is in the bigger town, 50,000 Lancaster,
Mm-hmm.
and then one is in a smaller town. How small of a town is that?
It's like the country. Let me see. I'm going to look it up for you. Population of Gap, Pennsylvania.
Gat?
Gap.
GAP?
Uh-huh.
Is that where Gap is headquartered at? Is that where they do all the fashion designs?
No, but Urban Outfitters is actually there. Isn't that funny? That's ironic.
Wow.
Auntie Anne's, Annie Ann's pretzels came out
Yeah.
of Gap, Pennsylvania, and Urban Outfitters has a huge distribution center, maybe a half a mile from my office. So there's 1,900 people.
So you're in a town of 2,000.
Yeah, but we draw from.
Usually it's 2x. Usually the draw is twice the township.
Yeah,
So
so
if
we
there's
draw from
1,900 people there.
We draw from southern, like the next county over, which is closer to Philly. So we draw from there as well. So that's
Okay,
Chestertown.
do you have an associate?
No, not right now.
Okay, so let's talk about the business of that. Let's switch from pediatric dentistry to the business of pediatric dentistry. Some people say, well, why would you want to get a second location? Because now you doubled your rent, you doubled your mortgage, you double all your overhead, and then you're in each location less time. How was this a good? How long have you had 2 locations?
It's been let's see, 11 years.
And was it a good business decision?
I think so because people were driving out to me in the further location, but now when I opened up this location closer to the heart of everything, then it increased the number of people that could come to me, and also appealed to people that had to drive before, and now they don't have to drive more than 10 minutes to come to me. So that helped. The other office, we keep that because it's closer to where the Amish are, and it's easier for them to get to me from there on their, horse and buggies.
What percent of them come to you on a horse and buggy?
Of the Amish, I would say almost 90% of them come in horse and buggy, or
So
they don't
10% drive a truck or something?
they have a driver, they have chauffeur, like they have Uber Amish. Can you believe that?
So an Amish person who can't have technology, a car, but he can take a cab or an Uber?
Yeah, well, it's actually, there's people that's their business, is they actually pick up Amish and they bring them to their appointments.
In
And they
what
charge
though?
per
In
hour.
a horse and buggy or in a car?
No, a regular car. These are regular people that have businesses that cater to the Amish. They pick them up, they bring them to their appointments, they charge per hour, and it's not cheap because we asked and we thought, wow, Uber would be cheaper for you guys.
Uber just did something really amazing in Phoenix. In Phoenix, only Chinese food and pizza foods delivered to your house.
Right.
none of the Mexican food or so many restaurants. Obviously, all the restaurants don't, deliver. Most restaurants don't deliver. But now Uber's have all these participating restaurants where you can call like your favorite restaurant and order from the menu online, and then Uber picks it up and delivers it to your house.
Wow. That's awesome. It's like Postmates in California.
It's like what?
Postmates? I
What's
think that's
that?
what it's called. I think it's a delivery service for all the restaurants where you order it online and then
Oh,
somebody
okay.
delivers it to your door. It's kind of nice.
Yeah. So I
They,
want to ask you. I only got you for 4 more minutes. I want to ask you. So you've been doing this for 26 years, and you're in 2 locations. Why have you not gone with an associate? Why do you?
well, I think it's time. I'm hitting that point where I would love to have more time to do things that I really want to do, travel more. So I'm actually looking. So if anybody out there is looking for a very successful practice to go into that's fee for service, low stress, call me. Call
Would they?
Dr. Farran.
And would they have to be a pediatric dentist?
I would love yeah, you almost have to be, yeah,
It has to be. Do you
yeah.
know the number one place that dentists are finding associates is on the
Where's that?
free classified ads on Dentaltown. There's 5,600 ad. No, I think yesterday it went over 6,000. There's like 6,024
Oh,
classified ads. So they're free. They don't cost you any money. There's 6 sections. You're looking for an associate, or you're an associate putting your resume. We copied Monster Job as good as we can. So I mean, you can post a PDF, a photo. So if you on there looking for an associate, hell, it's free. And the Dentaltown app, the next upgrade, they're programming it now. The next upgrade of the app will include the classified ads on the app. Because right now on the app, you can just do the message boards, the magazine, and the podcast. But anyway, yeah. So your friend and partner is on Dentaltown all the time. Just
uh-huh,
get a
yep.
picture, put them to work, posting that ad, and but yeah, you'll find one all the time, and as the younger they are, the more likely the dentist is going to be on Dentaltown and the app.
Mhm.
So and then the older they are, by the time they get to my age, usually they have too much dementia to register on Dentaltown, and they need assistance. But last question: what has got you most passionate about pediatric dentistry?
Well, it's definitely a good profession for me. It's a perfect fit. I mean, if ever I had to choose again, say I went through dental school again, I would definitely choose this all over again. Um, it's given me the lifestyle that I wanted and the freedom to do it with, having my own business. I can choose my own time. I can come and go. It's nice to be your own boss. There's a lot to be said about
Right.
it.
That's why, one of the biggest errors in mental thinking that I've seen the most reoccurring in my 54 years is linear thinking. I mean, you saw when the stock market went from 1994 to 2000, there were books out that the Dow was headed to 40,000. And the next thing you know, the whole thing collapsed in March of 2003. The pendulum swings way too far one way, then it always comes back, and everybody's linear thinking. And right now, people are all saying that all these millennials, they're lazy, they're never going to want their own business, they're all going to want to be employees. And corporate dentistry is saying, well, we've gone from 0 to 12%, so just give us a few more years and we're going from 12 to 24%, and then we're going to 50% to 80%. And it's linear thinking. I've seen this rodeo twice. I saw corporate dentistry real big when we got out of school with Orthodontic Centers of America, and a dozen trade on NASDAQ. Now there's none of them are traded on NASDAQ. There's not one on the New York Stock Exchange. There's not one on NASDAQ, and I don't think that Maria, who's been doing it 26 years, is a different animal than the new Maria, who's 26 years old, and that
Right.
she's going to want to be an employee at Aspen her whole life. I don't buy it.
Her. I want her. I want her to come here and see that you can make a living and not have to be an employee, basically a slave. That's what they do there.
Well, when are you going to post that ad? You going to have your what's that? Is he
Tonight.
posting it now? He's going to do it tonight.
Yeah.
Okay, well, all I want to say on my last comment is thank you so much for being one of the 4,000 pediatric dentists in America because, my God, I would never want to do dentistry if I didn't have someone like you to throw those kids. I don't know how you do it. I'd be on a Xanax, Valium. I'd probably be like Michael Jackson, just doing Propanol, just putting myself
So, yeah.
completely down. I mean, I mean, not to be rude, but I just think that would have to be the most horrible job in dentistry. And I'm so glad that there's people like you who love the most horrible job in dentistry.
Thank you.
Is that a compliment or is that an insult?
It is. It's a compliment. It
It's a
is. I
compliment.
take it as a compliment.
And it's so weird because the joy of my life was my 4 babies. I mean, they slept in my bed. I mean, I got 2 grandchildren. I just love kids, but I don't want to give one a shot in their mouth and try to do a pulpotomy and a chrome steel crown. I mean, I just think that's just tough. So thanks for loving what you do. Thank you for pediatric dentistry, and I hope you find an associate on Dentaltown's classified ads sooner rather than later.
Yes, definitely tonight. That'll be on there.
All right. Thanks
All
so
right,
much
thank
for coming
you.
on my show.